Hello everyone, this is Dr. Jawad. I want to talk about a concept that I get with a lot of my patients, and that's insulin resistant. Now, I have to give a shout out to Dr. Becky from drbeckyfitness.com. I found this on her YouTube page. I recommend that you go to her page. She has a lot of concepts on there that are easy to understand as well. So what is insulin? Okay, so when we break down when we eat carbohydrates and we break them down in our bloodstream, insulin, which is a hormone released by the pancreas, basically tells our body what to do with the carbohydrates we eat. Now, carbohydrates broken down in their simplest form is called glucose. What it does is that insulin helps deliver glucose to one of these three cells: the liver, the muscle, and the fat. And what it does, it acts as an escort to shunt the glucose into the cells. Very simple. So the other functions of insulin is to, first and foremost, decrease the level of glucose in the blood, increase the utilization of cell nutrients in the form when they're broken down, proteins, fatty acids, and vitamins. And like I said before, it delivers glucose to the cells to be utilized for energy in between meals. So insulin is very, very important. However, when we take in excessive amounts of carbohydrates, again in the forms of sugars, breads, pastas, so forth and so on, the pancreas has to release even more insulin to the cell, into the blood, okay, to help shunt the glucose into the cells. Now, when there's excessive amounts of carbohydrates, the pancreas, the amount of insulin released, can't keep up with it. So what happens is that it actually closes the door, because the function of insulin is to escort glucose into the cell. So then what happens, the receptor sites start to shut down. And there's a condition that's formed called insulin resistance. So when there's insulin resistance, what happens to the cells? The cells don't respond. So then there's a buildup of glucose in the blood. Okay? And if the cells don't have enough energy source, this is where you get a decrease of energy. This is where you feel fatigued, lethargic, and so forth. And also, another thing is that you crave carbs. You crave carbs because there's too much glucose in the blood, and when you crave carbs, this is where weight gain is so easy. So, with all that, so what's the treatment? The treatment is very, very simple. Three things. One, I always recommend adequate amount of sleep. Sleep in at least 7 to 8 hours. What sleep deprivation does, it makes your body more insulin resistant because you're just too tired. Also, too, exercise. When you exercise, it increases the glucose into the cells. The muscle cells, the brain, the liver cells, the fat cells for energy. Also, too, diet. Decrease the amount of carbohydrates. Remember, too many carbohydrates in the blood, your pancreas cannot keep up with the insulin release. You become insulin resistant, and you'll get a condition called type 2 diabetes, okay, because you're producing not enough insulin. So diet, decrease the carbohydrates, especially in the sugars, the simple sugars. So I hope you understand that simple explanation of insulin resistance. My name is Dr. Jawad. Thanks for watching.